The bottom line is this just does not work. Now, I spent yesterday at the Supreme Court, got to hear the oral arguments before the Supreme Court, and it was astonishing to hear the arguments put forward why we had to take over 1/6 of the economy, why we had to expand government power in a way that it's really going to fundamentally redefine the relationship of the government with the American people. And the reason was because, well, the uninsured, they cost us so much money. I got to tell you something. That's nonsense. The uninsured, yes, they may cost a little bit at the margin of the total health care system, but what's the real cost driver of health care in this country? What's the real reason that health insurance is going inexorably up and up and up? It is because the federal government does not pay its freight for Medicare, Medicaid, and S-CHIP. And it is the cross-subsidization from the private sector to fill that hole by the public sector that causes the cost of insurance to go up so much. And I was astounded that this argument was not made before the Supreme Court. I was concerned that they might be arguing from false premises. But regardless, what is the solution then to fix this problem of health care costs going up? Well, we're going to put a subsidy out there for the middle class in the exchanges. Oh, that'll help. And then the worst part, we're going to double Medicaid. Medicaid is the problem. Medicaid is the reason this cost is going up inexorably year over year over year. And what was the president's solution? What was Speaker Pelosi's solution? Let's double Medicaid in this country and see if that won't fix the problem. Will it fix the problem? I submit it will not. You ask yourself, how could the law be so convoluted as shown on this graph? And the reason is because if you look at the language that wrote that graph, this is not two copies of the law. This is one copy of the law in two volumes. How was it so badly done? You need do nothing more than look at the title page of H.R. 3590 from December 24th, 2009 in the Senate of the United States. Can I have additional 30 seconds?
Mr. Speaker, I yield the gentleman 30 seconds.
The gentleman from Texas is recognized for an additional 30 seconds.
Christmas Eve, December 24, 2009, resolved that the bill from the House of Representatives, H.R. 3590, entitled An Act to Amend the Internal Revenue Code of 1986 to modify first-time homebuyers' credit in the case of members of the armed forces and certain other federal employees. Wait a minute. That doesn't sound like a health care law. How to become a health care law? It's called an amendment to strike out all of the enacting clause after the enacting clause and insert the remaining 2,700 pages. I submit to you this thing was flawed from start to finish. It must be struck out by the roots. Otherwise, fiscal sanity cannot be restored to this country. I yield back the balance of my time.